So this is the first question. The doctor said, we have tried everything, but we are still in the dark about the cause. What does in the dark most likely mean? Now, you see over here, this is what we call as figurative speech. Okay, figurative speech basically means the opposite. There is no real dark over here. So I'll just type it down over here. So those who are a little bit new to figurative speech, this is very, very common, very common in OET listening and reading, called figurative speech. So just, I'm giving a small assignment, those who are a little bit new. So just search what is figurative speech, search what are idioms, and search what are metaphors. Okay, metaphors, idioms. So just go to the internet and you just make a small research on this, and you will be able to understand what they are. That is to express a point. So when we want to express a point, we use certain phrases. Okay, and those phrases do not have a literal meaning. That is what we call as figurative speech. Now, see, for instance, over here, the first question is, we have tried everything, but we are still in the dark about the cause. Okay, so what does in the dark most likely mean? So what's the answer option that you have chosen? All right. They are still unsure of the cause. Okay, that is the right answer. B is the right answer. So everyone can type in the chat box, right? So I'll just try to explain this to you. So here, what is the doctor saying? The doctor is saying, we have tried everything. Okay, the doctors, they tried everything for the patient, but, okay, but we are still in the dark about the cause. Okay, so what caused the disease? They don't know. Okay, so can you see in the dark? So if you switch off the light, can you see in the dark? You cannot see, right? So that is what they're saying. The doctors, they don't know. Okay, they don't know anything about the cause of the disease. So when we want to say, I don't know anything about the cause, I'm very unsure. Okay, so when we want to say that, we use a figurative speech called in the dark. So this is what it means. The doctor is still unsure of the cause. Right. Let's go to the second question. The nurse told the family, it's still early days. Let's wait before we jump to conclusions. What does early days suggest in this context? It's still early days. Let's wait before we jump to conclusions. What does early days suggest?
C.
Right, so we have answer option C. Let's see if that is the right answer. Yes, so C is indeed the right answer. Right, so still early days. Okay, so again, we are not talking about, day 1, day 2, day 3 and all. Okay, so it's too, so that we're just saying it's too soon. Okay, so what is the nurse saying? The nurse is telling the family, it's very early. Let's wait before we jump into conclusions. That is, be patient. Okay, just be patient. Okay, don't take any rash decisions. Okay, we need a little bit more time and we need little bit more information. It's too early to take a decision right now. Okay, so when we want to express that information, we can use this word as early days. It's too soon to make judgments. Okay, judgments basically means conclusions. Right, so this is slightly difficult. I'm not saying this is easy. Okay, it's a slightly difficult thing, but with regular reading practice, this becomes very much manageable. Let's come to the third question for the day. So the third question is, the physician said, we need to tread carefully here. His condition could worsen unexpectedly. What does tread carefully mean?
Sir, it's C. Act with caution and precision.
We need to tread carefully here. Yeah, see, act with caution and precision. Okay. So that is Chinchu's answer. Is there any other answer? Tread. What does tread mean? So if you go into a gym, you see a treadmill. Have you seen a treadmill? So what do we do on the treadmill? We walk there, right? We usually walk on a treadmill, right? So tread means to walk. Okay, tread is another word for walking. So here the person is saying, the physician is saying, the doctor is saying, we need to tread carefully. That means not literal walking. They're not telling you have to walk very carefully. That means you have to approach the situation. You have to navigate the situation very, very carefully. Okay, why? His condition could worsen unexpectedly. Anything can happen. The condition of the patient is unpredictable. So what will be the answer? As Sinju said, answer option C will be the right answer. See, carefully, caution, and precision. That is, you have to be very, very careful. Okay, all the other things you should be able to eliminate. Right. So it doesn't matter if your answers go wrong. The most important thing is that you just participate. Because the whole point of this multiple choice question in the very beginning is to get everyone to have their brains activated, okay, so that we can have a very productive session. Now let's come to the fourth question for the day. So this everything is figurative speech. The senior nurse described the shift as absolute chaos. We were putting out fires all day. So the question is, what does putting out fires imply? So remember, there are no fires. We are not putting out anything. But what message is it trying to convey? The senior nurse described the shift as absolute chaos. Try to sense the attitude of the speaker. Absolute chaos. We were putting out fires all day. Right. So we have everyone going with answer option C. So let's see. Yeah, that is indeed the right answer. Right. So putting out fires. So if there is a fire in our home, do you think we will wait for 2 hours? As soon as we see a fire, what we will do? Oh my God, there's a fire. And before it spreads, let's just extinguish it, right? So will we wait for 3, 4 hours? No, it's a very small thing. No, right? So that's the thing. So here they were managing many urgent problems, okay? Not small problems, very urgent problems. And they were managing it. Okay, they were dealing with it. That is what we mean by putting out fires. Okay, so this is what we call as figurative speech. Okay, something that you can very much expect in listening and reading sessions. Now let's come to the last question of the day, and then we will have a discussion regarding the reading part B. So this is something that we did previously. The doctor said, we cannot sugarcoat it. The prognosis is poor. Prognosis basically means the progress of a disease. What does sugarcoat it mean? The doctor said, we cannot sugarcoat it. The prognosis is very poor. What does sugarcoat? Sugarcoat, sweet. So again, there is no sugar, there is no coat over here. We cannot sugarcoat it. Here, they're actually asking you,
C or D, sir.
all right, avoid telling the patient B, or C, or make the truth more pleasant. Okay, completely. Okay, so over here we have A, B, as well as okay, D as well. Okay, so the right answer option is basically C option, right? Sugar coated. Now, see, the question is asking you, what does sugar coated means? So let me just give you a very small example. So if there are small children in our house, okay, and we want to give them medication, if we want to give them a bitter medicine, what we will do? We will mix the medicine in honey, right? We'll mix the medicine in honey, and and then only we will give the medicine to the children. Okay, only then they are more likely to consume the medication. If it is bitter, they are not going to consume it, right? So similarly, if we have pets in our house as well, if you want to give your pets any medication, what you will do? You will take some sweet thing, and inside you put the medication, and then you will give, right? So that is what we call as sugar coating it. So answer option C, make the truth sound more pleasant. Now you see over here, what's the doctor saying? The prognosis is poor. Okay, so there is a patient and the patient is not improving. Okay, the condition of the patient is still very, very bad. So that is definitely a bad news. Okay, it is not a good news, right? And here, so when we are revealing this bad news to the patient, the doctor is saying there is no need to sugarcoat it. Okay, that means there is no need to make it very sweet for the patient. Just tell the truth. Okay, that's the thing. So sugarcoat basically means making the truth. Okay, so we are not lying to the patient, we are telling the truth, but we are making it pleasant for the person. Okay, so for example, let's say we want to say, okay, you have a very serious disease. Okay, so but what we will do, we will say, okay, you know what, we have done the laboratory test. Okay, we have got your results. Don't worry, we can heal disease within 3 or 4 months. Everything is going to be okay. We are going to be supporting you. You have a lot of support. You don't have to worry about anything. And you have cancer. Okay, lastly, only we will say you have cancer or like that. Beginning itself, we won't say. So that sugar coating, okay, making the truth more pleasant. That is what we call as sugar coated. Right. So figurative speech, definitely this knowledge will help you out. So, actually, did I not? All right. So over here, what we're going to do is, so in the WhatsApp group, I had sent the agenda of the day. So that is what we will be discussing over here today. We're going to discuss reading part A today. So yesterday we discussed listening part B. So day before yesterday also we discussed listening part B. So today is going to be listening part A. No, reading part A. So let's just have a small introduction about reading part A. So in reading, you have total 42 questions, right? And reading part A we have, reading part B we have, and reading part C we have. So reading part A will consist of 20 questions. Okay, it consists of 20 questions, but you have only 15 minutes time. Okay, so see over here, there is a very, very strict time limit. You have only 15 minutes time. And within 15 minutes, what are you supposed to do? You have to, 1 second. Stop. Yeah. Okay. So within 15 minutes, what you have to do? You have to find answers to 20 questions. Okay, 20 questions, but only 15 minutes. And you have to look into 4 texts. Okay, there will be 4 texts, text A, text B, text C, and text D. And there will be almost 700 words over there, right? So this is where the challenge is. So if a student is saying, I find reading part A challenging, okay, that means the student is not saying the language in reading part A is difficult. The student is basically saying, I find it difficult to find the answers to all the 20 questions within 15 minutes. That is what the student is saying. Okay, if a student is saying, I find reading part A difficult, the student is not saying the reading part A, the language is very tough. That is why I find it difficult. No, the student is saying, I have only very little time, and within this little time, I find it very difficult to find answers to all the 20 questions. Right. So here, the number one skill that a student must have is time management skill, to effectively manage your time. Okay, that is the most important thing. Right. So there are certain strategies. Okay. So there is just one word that I will just type over here, and that one single word should be registered into your memory. Okay. And when it comes to reading, this is what you have to be, reading or listening. That is, you need to be a strategist. Okay. You need to be a strategist. So just imagine that there are two people playing chess. Okay. So I'm just, so this is, one person and this is another person. Okay. Both of them are playing chess. Right. So let's call this person A and this is B. Now, who is going to win the game? Both of them know how to play chess. Okay, the pawns move like this, the king moves like this, the queen moves like this. They know the rules, they know the regulations. Okay, but this person over here knows all these right strategies. Okay, person A knows all the cunning strategies. Okay, but person B does not know all the cunning strategies. They only know the rules and regulations. They know, okay, this is how to play chess. Okay, and who do you think is going to win? Obviously, this person. The person who is a strategist will win the game. As simple as that. So similarly, when it comes to reading part A, let's imagine there are two students. Both students know, okay, there are 15 questions. I mean, there are 20 questions. There are 15 minutes. We have four text A, B, C, and D, right? Both of them know. But the student who has the right strategies with them, the student who knows how to navigate themselves throughout the entire reading process, who implements the right technique, who brings in the right approach, that student is the student who's going to get the high scores. So your entire training should be to become a strategist. Okay. And over here, I'll be giving you certain strategies. Okay. And what you do is you try to implement those strategies into your practice and see if it is working out for you or not. Generally, it works. And my students have got, grade A consistently and all. Right. So let's talk about the strategies that is required when it comes to the reading practice. Right. So just give me a second. I just need to open the document that I have prepared. Just give me 1 second. So I forgot to take it up. And reading part A, if you do it quite well, then that will definitely help you in your reading part B and reading part C confidence levels as well. Because confidence is very important. If we become nervous, if we become anxious, if we become distracted, if our confidence levels goes down, no matter how much of a brilliant student you are, okay, no matter how much skills you do have, you're going to make it difficult for yourself to get your desired scores. All right, so this is the document I have. Okay, so let's see over here. So these are the strategies that I will be discussing with you. Right, so the first one is starting with the questions first. Okay, now we have four text. Okay, we have text A, we have text B, we have text C, and we have text D. Okay, so I'll just show you the question paper. See, this is reading part A. And see, this is the 700 words. Okay, there will be almost 700 words coming from text A. Then we have text B, we have text C, and we have text D. Okay, everything is related to one specific topic. So here the main topic is fractures, dislocations, and sprains. Now below these four text over here, you have 20 questions. Okay, now you see over here, the ultimate strategy, okay, because as I told you, everything is regarding time management. I would strongly suggest, okay, so I'm not forcing anyone, but my recommendation, what works for me and what works for my students to get their desired scores, is that you need to bring in the strategies that effectively helps you to stay very calm and minimizes your time expenditure as well as energy expenditure. Because the more energy you consume, see, every time you do an answer, every time you find an answer to a question, you are depleting your energy. You don't have unlimited energy, right? After you do listening part A, B, C, you have reduced your mental energy, and then you have reading part A. So and reading part B and reading part C are also very, very challenging. Okay, so if you want to get really good scores in reading part B and reading part C, you have to make sure that you're not wasting too much energy in reading part A itself. Okay, so you have to save your time as well as save your energy. So a right strategist, okay, so I'm not talking about a student who knows the rules and regulations of OET. I'm talking about a student who knows the right strategies of approaching OET. That student will always prioritize the questions first, not the text A, B, C, and D, because the OET is not giving you scores for reading the four text. Do you think the OET is giving you marks for reading the four text? No. The OET is giving you marks for finding answers to the questions. They have given you 20 questions over here. If you find answers to these questions, you pass OET. Okay, not for reading the foretext. So automatically the priority is always going to be the questions, right? So strategy number one is to begin with the questions. And again, I'll show you how it is done. And the second one is to read with a purpose. Right. Now you see over here, we have 20 questions. Now, if I want, I can read this like this. Procedures for delivering pain relief, the procedure to follow when spinding a fractured limb, what to record when assessing a patient, the terms used to describe different types of fractures. Like this, within 30 seconds or within 2 minutes or 1 minute, I can read all the, A, B, C, and D and the 20 questions 2 or 3 times, but it does not have any quality. Okay, it is not about how many times you read a question. You can read a question 3 4 5 times, you can read a text 3 4 5 times, but if there is no quality, if there is no reading with an aim, you're not reading with an aim, you're not reading with a focus, there is no purpose into your reading, you're not registering anything into your memory. So always remember this, quality of reading is more important than quantity of reading. Quality over quantity, right? So therefore, make sure if you are reading something, you're reading with an intention to grasp the message, right? So put some little bit extra effort and don't simply blindly read it. Simply blindly reading it is equivalent to reading nothing. Okay, and that is a waste of time. So that is what you have to do. Read with a purpose. Then trust your intuition. Okay, so I'll be explaining that to you here as well. So who is writing the OET? Business people are writing the OET. Engineers are writing the OET. School children are writing the OET. No, right? The OET has been designed only for medical professionals. So here, you are all medical professionals. You are writing an exam that has been designed only for medical professionals. So therefore, this examination requires you to trust your intuition. Okay, you have to trust your instincts. You have to be able to sense what the right answer is, where the right answer is. And that intuition is something that you naturally have. You just have to be very confident, have faith in yourself, and just trust it. Okay, so trusting your intuition is very important when it comes to reading part A. Then smart skimming and scanning. Okay, see, we are reading 700 words, 20 questions, 3 different types of questions, and how much time do we have? Only 15 minutes time. And we also have to read it with high quality as well, right? So we don't have too much time to read everything in detail. Okay, so you should be able to remember the keywords of the question. Okay, so that's why I told you, you always have to prioritize the questions. Okay, register the keywords into your memory, and with that keywords registered into your memory with a purpose, with an aim, you should go to the paragraph. And there is a method called skimming and scanning. That is, you're not basically reading the entire thing, but you're just scanning through. Okay, so that skill, okay, that I'll be teaching you how it is done. So that skill you need to have. The next thing over here is synonym recognition. You should be able to identify and recognize synonyms. And this is why, once again, quality reading is important. So even if you read this third question, 5 different types, okay, 5 times you have read the question, but even after 5 times you have read it, the student did not read with quality. Okay, the student did not register anything into your memory. The student will not be able to recognize synonyms because the OET is very cunning. OET is extremely cunning. In the text, okay, in the paragraph, they will not repeat the same words given in the question. They will use synonyms. And you must have the ability to recognize and identify synonyms. You have to train your mind for that. The next one is don't get stuck. Okay, so this is a very, very important strategy. Okay, so let's just give you a small example over here. So how many of you people have waited in ATM machines? So imagine that you want, so it is before, the UPI and, Google Pay and all came. So imagine it's the time when if you want money, you have to go to the bank or the ATM. And sometimes some people take lot of time, right? They just take a lot of time in the ATM, and you're standing in a queue. Okay, you're standing in a queue and you spend 5 minutes, you spend 10 minutes, you spend 15 minutes. So do you think it is easy for you to walk away? So if you are in a queue and you have just waited for 1 minute, If a friend is calling you, come here, you will go because you just spent 1 minute only in the queue, right? But if you have waited for 15 minutes, right, and still the person is taking a lot of time, and then someone is telling you, come over here, what will you say? No, 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 I cannot come. I spent 15 minutes here, okay, and I cannot afford to come back to you. I need to get my money, right? Only after that only I will come. So that's the thing. So what happens is you need to understand when it comes to OET, there are easy questions, there are difficult questions, and then there are very, very difficult questions. So let's just suppose that this eighth question, okay, just a very random example I'm giving you. The eighth question happens to be a very difficult question. Difficult question basically means a time consuming question. Okay, that is, they are using a lot of synonyms. It is not easy for you to identify the correct answer. So you spent 30 seconds, you spent 40 seconds, you spent 1 minute, 20 seconds. Even then, you are not able to find the answer. Okay, so the student is not likely to go to the ninth question. They will say, no, I spent so much time on this question. Unless and until I find answer to this question, okay, Raki, you may leave. Unless and until I find time, unless and until I find the answer to this question, I am not going to go to the ninth question. What happens is the student will be sacrificing all the easy questions as well. So if you get stuck, and this is very common, okay, not all questions are going to be easy. You will be coming across very, very difficult questions, right? So what that you have to do is, if you come across, okay, the eighth question, I spent 30 seconds, I spent 40 seconds, still I'm not able to find the answer, just temporarily you just mark it, okay? What you have to do is just take your pencil and just temporarily you just mark it over here like this. So you're just telling, okay, this is a time consuming question. I will come back to this question once I have finished all the easy questions. So just skip it. Temporarily, you just skip it and you go to the ninth question. Don't get stuck. Okay, there is no need for us to be very stubborn over there and tell, oh, unless and until I find the answer to this question, I'm not going to that. Okay, because ultimately, and what happens if the answer goes wrong? Let's imagine you spent 1.5 minutes on this question. And what if the answer goes wrong? Okay, then what happened? You spent 1.5 minutes for nothing. And that 1.5 minutes you could have spent for three easy answers. And you lost three easy answers, right? So that is one thing. Again, so these are all the right strategies you must have. Right. And then we have different types of questions. Okay. We have match the following questions. We have fill in the blank questions, and we have short answer type questions. So these are match the following questions. These are short answer type questions. And then we have fill in the blank questions. Now, if you generally speaking, the match the following questions are usually the easiest. Okay. The match the following questions are usually the easiest. These questions, the short answer type questions, as well as the fill in the blank questions, these are little bit more specific. The answers are very specific. It's just one specific detail, and you have to hunt. You have to hunt, and you have to accurately, you have to locate where the answer is. So compared to the massive following questions, these questions are very, very time consuming, right? And as I told you, the OET is not a very pleasant examination. Okay, those who have written the OET before, they know how stressful it can be, how much anxiety, how much nervousness can enter into your mind. Right. So all these factors will negatively impact your confidence levels. So what should you do? Okay, that is, you should be able to stay very calm and composed. So that is why I tell you, you begin with the easy questions first. See, as soon as you, so for example, let's say that a student is starting the OET examination and they are directly coming to the difficult questions. That is, they're directly skipping the easy questions. And now they are directly coming to the most difficult questions. That is the short answer type questions and the fill in the blank questions. As I told you, these questions are very tough. Compared to these questions are going to be tough. So the student's confidence level is not going to boost. Okay, the student will feel, oh, I have spent the first 5 minutes and these questions are very, very difficult. Okay, it's taking me too much time. So if that mindset enters, okay, and already they have that exam nervousness, exam anxiety. So what happens? That negativity will boost up. That negativity will boost up and they struggle even more. And as a result, the easy questions also, they will be sacrificing. So instead, you come directly to the easy questions. When the start begins, you come to the easy questions. Very comfortably, you find answers to the easy questions. Your confidence level will be very, very high. You will feel much more happy and positive about yourself. And with that happiness, with that positivity, with that confidence, you can come and you can do the difficult questions. Okay. And also, you will become very familiar. So by the time you finish these 7 questions, you will already become familiar with most of the content in text A, B, C, and D. Right. So that familiarity will help you in these questions as well. Right. So that is the next strategy. Right. The strategy over here is to begin with the match the following questions. Then you have to be very grammatically accurate. And this is most important for fill in the blank questions, because fill in the blank questions, as you can see, there will be an incomplete sentence and you should make sure that you're writing the correct information there, right? The missing information you should write, but simply you should not write the missing information. You must write the missing information such that the entire sentence forms a meaningful sentence. So maybe here it may be present tense. In the text, that it may be past tense. So sometimes you may have to convert the tense from past to present. You may have to convert. Sometimes from singular tense to plural tense, you may have to convert. Okay, that is, and sometimes there will be 2 words in the text, but only 1 word you should be able to write. That is, if you're writing the answer, it should form a meaningful sentence. If you write one extra word, okay, and that one extra word will sometimes make the answer to be grammatically inaccurate, right? So even if you do write the answer, you have to make sure, especially for fill in the blank questions, it forms a grammatically accurate, meaningful sentence. And then, very importantly, staying calm under pressure. This is guaranteed. Okay, pressure is guaranteed. Okay, that is, you are not at home, you are not in a very comfortable situation. It is a very expensive examination, right? And you carry a lot of dreams, you have put in a lot of effort, right? And again, this is an international examination. More than 40 countries have OET centers, right? And you have done a lot of sacrifices as well, right? So all these factors, and also the OET is not very easy. The OET is challenging. I'm not saying OET is difficult, but the OET is challenging for sure. And the OET has been designed, the listening and the reading specifically, it has been designed to make you into stress mode, to make you enter stress mode, right? But still, without becoming stressed, without becoming anxious, without becoming nervous, you should be able to keep yourself calm and composed so that your thought clarity is very high. And then you should, carry yourself forward with confidence. So that skill, that strategy is also very, very important. Right. So let's take a look into this particular reading that we have over here. So what was the first thing that I told you? When you get your reading question paper, okay? So when you get your, so let's imagine that all of you are sitting in the examination hall. This is your reading question paper. And again, every questions that we are discussing over here, all are Cambridge University materials, right? So if you see this logo, in your OET question paper, you can say that this is an original OET question paper. You can practice 100, 200, 300 materials. But if those OET materials, if they are fake OET materials, just go to YouTube. I can guarantee you, you can get 25,000 OET materials there, right? But they are all going to be fake OET materials. When you book your examination, you are going to write a Cambridge University prepared question paper only. So when you're in the preparation phase, if you're a very smart student, you will only prioritize the Cambridge University materials. Only a student who is not very serious about clearing the OET, they will repeat the same mistakes. And that is practicing with the fake OET materials, which is the guaranteed way to ensure failure in OET. But it is a very sad thing, because some students, they just like practicing with fake OET materials. But I don't want any of my students to do that mistake. So anyway, let's just imagine that all of you over here are in the examination hall, okay? And you have been given this question paper, and they're telling you your 15 minutes time starts now. So as I told you earlier, your duty is to not read text A, B, C, and D. You're getting marks for finding answers to the question. Right. So you should always prioritize the questions. That is, skip A, B, C, and D and come to the questions over here. And I also told you that the first type of question that you should do is the match the following questions. Once you have finished this, then only you have to go over here. You may disagree with me, but this actually works. Okay. And that's why I'm strongly saying this. But before you go into the match the following question, what I suggest is you come to the text. Okay. So that is you get, so they're saying your 15 minutes time starts now. So before you go to the questions, what you do is you just read the headings. Okay. Just read the headings associated with each text over here. Now, what is the main topic over here? The main topic is fractures, dislocations, and sprains. So this you read. Okay. Okay. The main topic over here is fractures, dislocations, and sprains. So all the four texts A, B, C, and D will be related to this. Next, you come to the text A over here. Now, what is the heading over here? Fractures, dislocation, and sprain. So just these three words, you see, these three words are written in bold letters, and we can say that is a subheading over here. Now, there is no need for you to read text A, B, C, D. I mean, all this information over here. There is no need for you to read all these three things. You just take your pencil and you just underline the headings over here. Okay, the first heading over here is fractures. The second heading over here is dislocation. The third heading over here is sprain. Okay, and this is quality reading. Okay, so you understand, okay, text A is about definition. Okay, so you have not read text A over here, but you only have read these three words, but you now know, okay, text A is about definition. What is fractures? What are dislocations? And what are sprains? Is it? So maybe you have spent, now you see, you have spent just 3 seconds over here, maximum. Within 3 seconds, you have a thorough idea of what to expect in text A. Just 3 seconds. Now let's come to text B. Okay. Now what is the heading over here? Simple fracture of limbs. Okay. Simple fracture. Okay. So we have different types of fractures. So here it is simple fracture. And what is the keyword over here? Limbs. Limbs basically means what? Your arms or legs. Okay, so if a patient is having a arm fracture or a leg fracture, and if it's a simple fracture, that information you can get over here. So if there is a skull fracture, or if there's a nose fracture, or if there's a chest fracture, that information will not be in text B, only limbs, okay, and simple fractures. See, that's it. That's the only thing you need to read. And now you just read the subheadings over here. So if a patient is having simple fracture of limbs, immediate management, so immediate treatment. And over here, clinical assessment. So how to provide immediate treatment for a patient coming with simple fracture of limbs. How to clinically assess. Assessment means what? How to observe, okay? How to check, okay? How to assess a patient. So if a patient is coming to the clinic, how to assess a patient if the person is suffering from simple fracture of limbs. That's it. Now you see over here, examine, okay, that is a clinic, it comes under clinical examination, how it is done, what and all to check, okay, what and during the examination process, what and all to check. And then we have management of simple fracture of limbs. So now what do you see? You did not read. Now you see text B is very long and lengthy. You did not read the entire thing over here. You have just spent barely 5 seconds. Just barely 5 seconds you have spent, and you have a thorough idea. Okay, you have a thorough idea. Okay, text B is about simple fracture of limbs, immediate management, clinical assessment, examination, check weather, and management. That's it. No need to read the entire part, the text B, because that is not, the OET is not giving you marks for simply reading A, B, these things. And next you come to text C. So what is the heading over here? The heading over here is drug therapy protocol. Okay, that is drugs means what? Pharmacological medications. Okay, so if a patient is suffering from fractures, sprains, or dislocations, what pharmaceutical therapy should be given to the patient? Okay, and what's the protocol for it? And then you just, okay, we have drugs, the name of the drug is mentioned, the form is mentioned, okay, strength is mentioned, route of administration, recommended dosage, and duration. That's the only thing you need to read. Okay, and now you see you have an idea. Okay, text C is all about drug therapy, the treatment. Okay, that is how to provide treatment for a patient coming with coming with fractures. And next you come to text D over here. Now, what is text D telling? Technique for plaster backslap for arm fractures. Same principle for leg fractures. So technique. Technique means the method. Okay, method for applying plaster backslap. So if a patient is having arm fractures or the patient is having leg fractures, how to apply? What is the method to apply plaster backslap? That is what you can expect in text D. Now you see over here, within 20 seconds, within first 20 seconds, you have a clear understanding of what to expect in text A, text B, text C, and text D. So text A is just definitions. Text B is about, simple fractures of limbs, assessment, immediate management. Text C is drug therapy protocol. And text D is technique for plaster backslap. Now see, within 20, maximum 30 seconds, you have an idea. And as I told you, you have to trust your intuition, and I'll tell you how it works. On the other hand, if a student is, in panic mode, okay, and they are directly coming to the text over here before going to the question, they're coming to text over here, and what they will do, they will read text A, B, C, and D. But how do you think the student will read? The student is not going to take their time. The student is not going to take their time and to understand each and every word. Definitely they will be in a hurry because they know I have only 15 minutes. So simply they will read. Simply they will just read text A, text B, the entire thing. Text C they will read, text D they will read. Simply they will just read, and they will just register maybe just 20% of the memory. Okay, they have read A, B, C, and D. They may have spent maybe 2 minutes or 2.5 minutes, but they will have just a very, very vague memory only. Okay. But more effective than that is simply reading the main headings with high quality. Okay. You get a much better effect from that. So that is strategy number one. Right. Next, what you need to do is after you have read these headings over here, then what you should do is then you should come to the questions. And as I told you, the easiest questions are the match the following questions. Again, I'm not saying that these questions are very, very easy. Of course, it is very challenging. It is challenging only, but compared to short answer type questions and compared to fill in the blank questions, these are much more manageable. Right. So you come over here because what is the goal over here? The goal over here is to minimize your time expenditure and to minimize your energy expenditure and also to boost your confidence levels. Okay. We want to do the entire reading with a very happy, positive mind. We don't want to do the entire reading in a very anxious, scared, fearful state of mind. Because it has a very huge different outcome. Right. So now you come to the match the following questions. And over here, there is something. I'll just type over here. It is called comprehension. Step number 2 is called retention. And then comes detection. Right. Comprehension. So comprehension basically means understanding. Okay. So again, remember I told you quality reading. Okay. You have to grasp the meaning. You have to read with a purpose because why? In the paragraph, they will use synonyms. Okay. They are not going to repeat the same words over here. They will use synonyms over there. Okay. So simply reading blindly will not do you any good. So that is why comprehending the question, that is understanding the question thoroughly, is extremely important. Right. And for that, you have to do the keyword analysis. Okay, keyword analysis. That is, you have to identify what are the keywords and you need to underline them and link them together. If you do the keyword analysis very nicely, you'll be able to understand the question. Right. Now, let's take a look into the very first question over here and let's comprehend the question. And once you have comprehended, once you have understood the question, then comes retention. Retention basically means what? Retention means retaining the memory of the question. You have to register the memory of the question into your mind. You must not forget what the question is. So you have read the question, you have understood the question, and what happens if you forget the question? If you forget the question, then you don't know what you're looking for. You don't know what you're reading for, right? So that strong memory of the question should be there. And with that memory in your mind, then you have to go and try to detect what the answer is. Right. So let's take a look into the very first question over here and let's do the keyword analysis. Okay. So over here they have written decide which text. Okay, that is whether it is coming from A, B, C, or D, the information comes from. Okay, so if you believe the answer is coming from text A, then you have to write capital A over here. Okay, text B means you have to write capital B. So here, this is the first sentence over here. Okay, so here, in which text can you find information about? So let's read the first question. So I want everyone to, trust your intuitions as we go over here. Okay, so let's just go through the headings over here. So text A is just definition, fractures, dislocations, sprains. Text B is about simple fractures of limbs, immediate management, that is first aid. Immediate management is first aid. Clinical assessment, that is how to check. Okay, and then management over here. And then we have drug therapy protocol. Okay, a patient is coming with fractures. What medication do we need to give them? Okay, and then we have technique for Black slab. Right, so that should be in your mind. Now you're coming to the first question over here. The first question over here is procedures for delivering pain relief. Okay, so what do we understand? A patient is having a fracture. The patient is in a lot of pain. Okay, and we are providing pain relief to the patient. Okay, now the main focal point of the question over here is procedures. Okay, procedures basically means methods. Okay, in what ways can we provide pain relief to the patient? Now, trust your intuition. So now I want you to trust your intuition, right? So what do you think? Is your intuition telling you procedures for providing pain relief? What is text A? Text A is only definitions, fractures, dislocations, and sprain. Do you think the procedures for providing pain relief is going to be in text A? No. Your intuition is telling definitely it is not going to be there. Right. Now you have text B, simple fractures of limbs. And here they have written, okay, first aid is mentioned. And also we have management over here. So yes, there is a likely, okay, there is a very strong likelihood that the answer could be in text B. Now let's come to text C over here. Text C, what is it? Okay, drug therapy protocol. So a patient is having fracture and we need to give them a medication. Okay, and we have a table over here, drug, strength, route of administration, recommended dosage, duration. And we have, a very potent painkiller medication here, that is morphine. Okay, so it could be in text C as well. So your intuition telling is it is going to be in text C. But what about text D? What is text D telling? Technique for plaster backslap. That is, if a patient is having an arm fracture, leg fracture, how to apply plaster backslap. So very easily you can say the answer is not going to be in text D and the answer is not going to be in text A. Okay, you definitely know the answer is not going to be in text A and the answer is not going to be in text D. Right. And did we read text A? Did we read text A fully? Did we read text D fully? No. But without even reading it, your intuition is telling you, yes, the answer is either going to be in text B or text C. Now, between text B and text C, now you see over here, drug therapy. So when a patient is having pain, okay, from a fracture, what will we give the patient? We will give them a strong painkiller, right? So that is what the answer. We have just one very strong painkiller over here, that is morphine. So your intuition is telling you, okay, the answer is most likely to be in here. So now you just need to confirm, okay? Just confirm whether the procedures for providing pain relief is mentioned or not. Okay, now see morphine. So pain relief is mentioned, but the question is asking you, what are the procedures? Okay, now you see over here the procedure. So we have to give an ampule, morphine in an ampule form. In this strength we need to give, and we have the routes of administration. So we have to give it by either intramuscular, subcutaneous, or IV, intravenous. Okay, now you see over here, these are the different procedures in which we can provide pain relief to a patient, right? So the answer is most likely to be in answer option C, text C. Okay, and you should be able to write capital C as the answer over here. Right. Now, how did we find the answer to the first question? Did we read text A, B, C, and D? No, right? Just read the headings. Now, let's come to the second question over here. Now, what's the second question? Once again, let's do the comprehension. Okay. Now, what we're going to do is comprehend the question, then retain the memory of the question. Comprehension, retention, and then detection. So again, not blind reading, but quality reading. So let's read the second question. The second question is telling the procedure to follow when splinting a fractured limb. So we know that limb basically means an arm or a leg. Okay, and splinting basically means, I suggest, applying that dress, like, that special dressing, that casing to protect the patient from, further complications. And what is the procedure? What is the procedure when we are applying a splint for a fractured limb? Now, what do you think your intuition is going to tell you? Do you think your intuition is going to tell you it is going to be in text A? No. Text A is only about the definitions. Text B is about first aid and clinical assessment. That is how to assess, how to check if a patient is having a simple fracture. Here we are talking about not assessing. Here we are talking about applying that is splinting a fractured limb, procedure to follow. And what is text C? Text C is about drug therapy protocol. Okay, so here it is medications. So what is your intuition telling you? Your intuition is telling you it is most likely to be in text D, right? So we have only read the heading, but your instincts are telling, yeah, it is most likely in text D, because why? The procedure to follow, the technique to follow when we are splinting, that is plaster black slab for arm fractures and leg fractures. So what are arms and what are legs? They're all limbs, right? So the answer option is going to be likely D. And you see over here, they have mentioned all these steps. These are the procedures. Step number 1, measure a length of non-compression cotton stockinette from halfway to the middle finger. Wrap the cotton padding. Measure a length of the plaster of Paris. Immerse the layered in a bowl. Ensure any jewelry is removed. Okay. Wrap the bandage. Do not apply pressure. So these are the procedures. Okay. So the answer is most likely to be in answer option D. Right. So this is how you should do. Now let's take a look into the third question. So what's the third question over here? What to record when assessing a patient? So what is the question asking you? What's the focal point? So here, what are we doing? We are assessing a patient. Okay. And what to record? Record basically means what to note down. Okay. What to write down when you are assessing a patient. Now, what is your intuition telling you? The intuition is telling you it is going to be in text B, right? Assessing a patient. You see, simple fracture of limbs. And see over here, clinical assessment. Okay, that is what to. Now the question is, what should we write down when we are assessing a patient? So you're coming to text B, and here it is clinical assessment. Right. Now let's see inquire about anticoagulant use. Now you see over here, when we are assessing a patient, obtain patient history. So we have to write down the patient history. We have to write down the circumstances and method of injury. We have to write down the medication history of the patient. And also we need to ask whether they are using any anticoagulants. Right. So these are the things we need to write down or record when we are doing an assessment of the patient. Now you see, there is no need to read anything else. You have already read, you have basically understood, you have confirmed the answer, and you should be writing answer option B over there. Now you see how quickly you're able to find the answers. Right. So imagine you're in your examination hall. You are in your examination hall, and within just 20 seconds, you have finished reading the headings of text A, B, C, and D, right? And now you have come to the, what do you call it? The match the following questions, right? And within the first 1 or 2 minutes itself, you have basically the first, 6 or 7 correct answers. So how happy are you going to feel? You're going to feel very good about yourself, right? You're going to feel, okay, I'm so, proud of myself. And this is something that I can definitely do. So with that elevated and boosted level of confidence, you can come to the difficult questions, right? Now, let's just do 2 more questions over here. Now, maybe, shall we do the 6th and 7th question? So the 6th question over here is what to look for when assessing, what to look for when checking an injury. Okay, so here the patient has come to the clinic, and the question is asking what should we look for when checking an injury. So once again, what is your intuition telling you? It is going to be telling you text B, right? Yeah, very good, right? Text B, because what to check when we are checking for an injury. So obviously you will come to text B, right? And clinical assessment. Okay, now let's confirm what we should check. Okay, if there's a patient is having an injury, right? Patient is having an injury, and what should we check when we are assessing? Now let's see. Perform standard clinical observations. Examine. Examine means to assess, and record. Now see, record is over here. Color, warmth, movement, sensation in hands and feet. Okay, so if a patient is having an injury, okay, if a patient is having an injured limb, what and all you should check? You should check the color of the limb. You should check the temperature of the limb. You should check the movement, the sensation, right? So these are the things you need to check. Okay, you need to examine if they have an injured limb over here, right? And that's it. So the answer is going to be what? Sixth answer is going to be text B. Now let's read the seventh question over here. So the seventh question over here is, how fractures can be caused. Okay, so what causes fractures? Okay, that is how fractures happen in patients. So what is your intuition telling you? Yes, very good. Your intuition is going to be telling you it is in text A, because text A is all about an introduction to fractures, right? The definitions of fractures, right? So let's see again. So your intuition is telling it is not. So how fractures can be caused. Do you think it is going to be in text B, plaster black slab technique? No. Well, it is going to be over here about morphine? No. Do you think over here about first aid and treatment? No. Right? Here it is going, most likely it is going to be in text A. Right. So now the question is asking you, what causes fractures? Okay, the etiology, right? Etiology of fractures. So let's read. So let's just read the text A. Buckle and break in the bone. So what's the other name for fractures? If there is a break in the bone or a buckle in the bone, that is what we call as a fracture, often occurring following a direct or indirect injury. So what causes a fracture? And direct injury causes a fracture, and indirect injury also causes a fracture. Example, twisting, okay, violence to bones. Clinical fractures include. No, that is not. So see, what causes fracture? Twisting, violence to bones, and direct or indirect injuries. So what is the answer going to be the seventh question? The answer of the seventh question is going to be text A, right? So this is a skill that you need to perfect. Okay, it requires a little bit of a consistent practice from your side, but over the time you will be able to sharpen your abilities for this. So this is how you have to be a right strategist. Now you see, on the other hand, there are some students, what they will do is, as soon as they get the question paper, they will read text A, they will read text B, they will read text C, and they will read text D. And they have spent energy. So there is a waste of energy that has happened. And that energy they could have spent for text B, reading part B and reading part C, right? So they wasted that much energy. And from 15 minutes, now they have just 12 minutes, 12 or just 13 minutes, right? And only so within 12 minutes, now they need to find answers to 20 questions. Earlier, it was just 20 questions in 15 minutes. But now these students, they read the text A, B, C, and D, and now they have to find answers to 20 questions within just 12 minutes. Now see, they unnecessarily, they put a lot of pressure on themselves. Okay, and in what mindset do you think these type of students are going to practice with a very happy mind? Obviously, no. Okay, now they have put themselves into stress mode. And what happens when your mind is stressed? If your mind is stressed, will you take a very good decision when you're very angry? Let's imagine you're very, very angry, and do you think you will take a very good decision? Oh, do you think you will take a very life-changing decision when you're very angry or when you're very upset? No, right? Because your mind is not functioning properly in that emotion state. Okay, it is when you're calm, it is when you're composed. Okay, it is in that state you are able to think high quality thoughts. So if you want high quality thoughts, if you want high quality judgments, you should be in a state of calmness. So don't unnecessarily put yourself into unwanted tension. And what advantage is there? So this is all British English. This is not simple LKG level English. Simply reading it one time to understand everything. It requires in-depth reading as well. So it is just a waste of time and energy if you ask me. Again, everyone has their own brain structure, but generally speaking, I would suggest that you prioritize the questions first, right? And in this method, first 20 seconds, what we did, we read the A, B, C, D headings. And within the 21st second, okay, not even 30 seconds has gone by, within the 21st second itself, you are now coming to the finding the answer to the first question. So within the first 2 minutes, you already have answers to 7 answers. Within just 2 minutes, you already have answers to the first 7 questions, right? Whereas the other students, they are just beginning. They are just beginning the very first question. So this is the difference between a person who is a strategist and a person who is not a strategist, right? But this is a skill that you need to develop. And now you have to come to the short answer type questions, right? Now see, what is the advantage? So there's a two advantages over here. The first advantage is you're feeling good about yourself. Okay, you are feeling very awesome. And the second advantage is you already have some familiarity. Now you see over here, to reading, to find some answers, okay, to find answers to the first 7 questions, we will obviously read. We will do a little bit of reading of text A. We will do a little bit of reading of text B, text C, text D. So we will read, okay? We will read some parts of A, B, C, and D. Okay, so by the time you finish the first 7 questions, you have read A, B, C, and D, essentially. Right. So you have a very good memory. You are already familiar with the content of A, B, C, and D, and you have all these correct answers here as well. And with that familiarity, if you are doing the short answer type questions, it is going to be much more easier. Right. So let's take a look into the 8th question over here. So these questions are a little bit more specific. Now the massive following questions are not specific. Okay, it is very general. You just have to understand the main keyword. You have to trust your intuition. You have to just go there. You just have to scan and skim. And once you are confirmed, then you can write that as the right answer. But over here, the answer is not general questions. It is a very specific question. So here you have to hunt. Okay, you have to hunt very accurately, precisely where the answer is hidden. Okay, you have to locate the hidden answer. So let's take a look into the 8th question. So the 8th question is, what should be used to elevate a patient's fractured leg? Okay, so here they're talking about a leg, okay, not an arm, and they're asking you what should be used. So what product? So the name of a product, okay. So what product should be used to elevate a fractured leg? Okay, so that is the only thing you should write down. So you can write words, you can write numbers, or you can write both. And there is no need to write full sentences. Okay, no need to write copy down and write very long sentences. Just 1 or 2 words. Maximum it is just 1 word or 2 words. 2 words, 3 words is very, very rare. Right. So comprehension. What should be used to elevate a fractured leg? So that memory you have. Okay, you have understood the question. You have retained the question to your mind. And now with that memory, with that focus, okay, now you're reading with an aim. Okay, now you have a duty. Okay, my duty is to find if a patient is having a fractured leg, what we should use to elevate it. Okay, so that is your aim over here. So with that only thing, that's the only thing in your memory. With that in your aim, you have to trust your intuition and try to see where the answer is located. Now, it is not going to be in text A because text A is about definitions. Now, text B, maybe it may be there. Okay, the management of weather. It's not going to be in text C, and it could be in text D as well. Okay, so it is either in B or it is going to be in answer option D. I mean text D over here. So let's maybe go to text D because fractured leg, they're talking about, first aid treatment. Okay, so what to do if a patient is having a fractured leg and what should we use to elevate it. So this is where you bring in your scanning and skimming skills. Okay, so I'll just type it over here. Scanning and skimming. So what you have to do is there is no need for you to read every single word with a lot of effort. Okay, no need to read everything in a lot of effort because you don't have the time for it. Okay, so what you should do is you should have the keywords in your memory. Okay, what should I use to elevate a fractured leg? Fractured leg, elevate. Fractured leg, elevate. Fractured leg, elevate. These are the only 2 things that should be in your mind. Okay, and with that in your mind, you have to just simply scan through. Just go scan and skim because and you should be able to do it very carefully because you can expect synonyms. Okay, so you should be able to avoid the distractors like that. Okay, so this requires a little bit practice, right? So let's take a look into the first question. I mean, the heading. So this is immediate management. So halt any, okay, this thing, immobilize, okay, provide pain relief. So see, I'm not basically reading. Okay, I'm just looking into it. I'm just scanning, but the keywords in my memory, elevate, fractured leg, elevate, fractured leg. Okay, clinical assessment. Okay, obtain patient history. Okay, it's not over here. Perform clinical observation. Examine. Perform clinical examination. Okay, so examine any wounds, skin over the fracture, range of movement. Check whether limb is out of shape, limb is warm. Okay, so see, this is what we call as scanning and skimming. Right, that is now see management. Okay, split the now see suddenly I'm able to see elevate suddenly. So the keyword that I'm looking for, I have been able to spot it. So now I go into alert mode. Okay, elevate the limb. Now see a sling for arm injuries. So what should I use to elevate a arm injury? So if it's an arm fracture, I have to use a sling. And here they have written a pillow for leg injuries. Now, what is the question asking you? So this is how tricky the OET will be. So the student does not read the entire sentence properly. They will write sling as the correct answer. But sling is for arms, right? Over here, the answer will be, yes, pillow. Right, very good. Okay, so the answer will be pillow. Pillow for legs. So you will be writing pillow over here. So without any spelling mistakes, you have to write pillow. Okay, so a pillow is what we use to elevate a patient's fractured leg. Right, so now let's come to the ninth question. Okay, the ninth question is a little bit tricky. Right, so the ninth question is going to be slightly tricky. Let me see if you're able to find the answer. So the ninth question is, what is the maximum dose of morphine per kilo of a patient's weight that can be used given by the intramuscular route? So here they're asking you, what is the maximum dose? Maximum dose of what? Of morphine. Okay. Per kilo of a morphine per kilo of a patient's weight that can be given using the intramuscular route. Okay. So you very thoroughly the answer is going to be in text C. Okay, the answer is definitely in text C because the morphine is over here. And what is the thing we look for? IM. Okay, so in the question they have asked you, what is the maximum dose? What is the maximum dose of morphine that we can give to a patient who is suffering from intramuscular? Okay, and here they have written 0.1 to 0.2 milligram per kilogram to a maximum of 10 mg. Okay, and this is the entire sentence. So what is the answer going to be? I'll just show you the question once again. The question, what is the maximum dose of morphine per kilo of a patient weight that can be given using IM route? And the answer is over here. Okay. So type your answer in the chat box. Okay. So I want almost everyone to participate here. I'll give you 10 more seconds. I want everyone to participate. All right, so we have, so this is how tricky the OET is. Okay, so this is why quality reading is very important. Now you see, it's just come to the question over here. The question is asking you maximum dose of morphine, but they're not asking you what's the maximum dose of morphine for a patient. They're asking you what is the maximum dose of morphine per kg. Okay, per kg, what is the maximum dose that we can give? Okay, through the intramuscular route. Now you see over here, they have written for the maximum dose. Okay, the maximum dose of morphine for a person is 10 mg. But the question was asking you, what is the maximum dose per kilogram that we can give? So the minimum dose is 0.1, right, per kg. And the maximum dose is 0.2 milligram per kg. This is the maximum dose. Now see, this is why quality reading and staying very calm. Okay, so if student is very, very stressed, they are going to be making small errors like this, right? So 0.2 milligram per kg is the right answer, right? And this is, so how did we find the answer to it? We read the question, we identified the keywords, we linked the keywords together, and then we were reading with an aim, because there was a very focused aim in our mind, and with that we went to the text C and we read it very carefully, and without falling into the traps of OET, we actually wrote the correct answer. Right, so this is how we should do. So now let's maybe do the 14th question over here. The question is asking you, what condition might a patient have if severe pain persists after splinting, elevation, and repeated analgesia. Okay, so here the question, what is the focal point of the question? What condition? Okay, so condition means what? A disease condition. Okay, so what a disease condition might a patient have? Might means possibly. Okay, if severe pain persists, so the patient is having severe pain, persisting severe pain. Okay, severe pain is persisting even after splinting. So we have applied splinting, we have applied elevation, and we have given them repeated painkillers. Okay, repeated analgesia we have given, but still the patient is having severe pain. So then what is the name of the condition? So we know the name is, the answer is going to be a diagnosis. Now, what do you think? Where do you think the answer is going to be? Is it going to be in text A, B, C, or D? Text A is what? Definition. Text B is what? First aid. Text C is about morphine. And what is text D? Okay, it is going to be these things over here. So my intuition is telling that it is either going to be in text D. Okay, so again, my intuition may be wrong. Okay, my intuition may be wrong. So if it is wrong, no problem. I'll just go to the next one. Right. So let's just read over here. So again, splinting and that thing and all is mentioned. So let's see if it is mentioned. So here we are not reading. You have to train yourself to basically scan and skim. Okay. So the keywords, okay, repeated analgesia, splinting, elevating, everything is done. But still the pain is not going away. Severe pain is persisting. And what condition is it? So let me see if it is mentioned. So measure length of this thing. Okay. Wrap the cotton padding. Okay, measure a length. Okay, fold this. Immerse the layered plastic note over here. Ensure any jewelry, light mold, neutral position. Do not apply. Okay, one is a wrap bandage. So my intuition was wrong. Okay, so I suspected. Okay, elevate was mentioned. This thing mentioned. So my intuition over here was wrong. So maybe let's come to the I would say maybe text B. Okay, see, elevate and all is mentioned over here. So maybe it could be over here. Okay, text B. So my intuition is telling. So let me just see if it is mentioned. Now see, when I'm going through this, I hear suddenly I said, now see, severe pain. Now see, the keywords in our memory. The pain, the keywords are very strong in my mind. So I was able to, when I suddenly I looked over here, I saw severe pain. Okay, and see what I have the written. Consider compartment syndrome. Okay, consider compartment syndrome where pain is severe. Severe pain is there and unrelieved by splinting. Okay, unrelieved by splinting, unrelieved by elevation, or even two doses, that is multiple dose of analgesia. So what condition is it? The condition is going to be what? Compartment syndrome. Right. Very good. Okay, so that's the thing. So the thing is, our intuition may be right, may be wrong. So this is where the intuition building needs to come. Okay, if it is wrong, no worries. Then you have to go to the next one, where you feel the answer is more likely to be. Okay, and then you have to sense it. Okay, and this is how you have to do. So the answer is going to be compartment syndrome. So without any spelling mistakes, you should be able to write down this. Right. Now let's come to the 15th question. So the 15th question over here is basically an fill in the blank question. All right. So let's read the 15th question. Now here you have to make sure that there is grammatical accuracy. Right. So complete each of these sentences. So you have to complete these sentences meaningfully with grammatical accuracy with one word. Okay. With one word or a short phrase from one of the text. Each answer may include words, numbers, or both. So let's see what the 15th question is. Falling on an outstretched hand is a typical cause of a dash of the elbow. Okay, so here, how is the patient falling? The patient is falling on an outstretched hand. That is, the patient, when he is falling, he is stretching his hand, and like that, he is falling. Okay, now they're asking you, falling like that is a typical cause of what? Okay, and we have the keywords over here. Okay, so we have elbow over here, right? We have the first keyword is elbow, the second keyword is outstretched hand, and the third keyword is cause. Now here there are two different types of words. The first word is called linking word. Okay, linking word, and then we have keywords. So the linking words are the words that are the nearest to the fill in the blank. Okay, the blank. So what is the word that is very near to the blank over here? So there are two words, right? So the two words over here is elbow. Okay, the elbow over here and typical cause. Okay, cause over here. So these are the linking words. And these are the keywords: falling, outstretched hand. Okay, so keywords and linking words can also be the same, right? So our intuition is telling, okay, it is not going to be in text D. Text D is what? Technique. Text C is about morphine. Text B is about assessment. So maybe text A, okay, falling. So it's like an introduction to something. Okay, so let's see whether, let's come to text A. So my intuition is telling, my instincts are telling, my medical experience is telling that it is either, it is most likely to be in text A. So with a very calm mind, I'm coming over here and I'm once again scanning. So I'm looking for words such as elbow. Okay, I'm looking words such as falling. Okay, so let's see. So here there is no elbow, there is no falling. Let's see here if there is any, say elbow over here. Now see, I located the word elbow. Right. The dislocation is where a bone is completely displaced or is from injuries away from the fissure. Okay. Elbow dislocation. See, falling, outstretched hand. So all the keywords are here. Outstretched is mentioned, falling is mentioned, and elbow is mentioned. Now you see over here, elbow dislocation. So we have two words over here, elbow dislocation. Now let's come to the answer of this thing over here. Now, can we write elbow dislocation? So if I'm writing so the answer, okay, the answer in the this thing was elbow dislocation. Now, if you write elbow dislocation, you will be not getting full marks. Maybe you'll get partial marks. The OET does give you partial marks, but not full marks for this. Why? Now just read. Now you see, just read the entire sentence. Now the entire sentence is saying, falling on an outstretched hand is a typical cause of a elbow dislocation of the elbow. It is not a grammatically accurate sentence, right? Because already the elbow is mentioned. Okay, and that is why we have all these remaining words, and the sentence structure has been modified to incorporate this elbow over here. So there is no need for you to write this elbow here. Now you read the sentence. Falling on an outstretched hand is a typical cause of a dislocation of the elbow. So this forms a more grammatically accurate sentence. So that is why it is very important in reading part A that even if you find the correct answer, okay, you should not simply write what you see there. You have to make sure it forms a meaningful sentence, right? And that is why I told you these questions are time consuming questions. To find these answers are very difficult, and also to make sure that you're writing it down such that you get the maximum marks, that is also a little bit difficult because you have to put a lot of thinking, a contemplation is required, right? So the answer will be dislocation. Let's come to the 16th question over here. The 16th question over here is, let's just read it. Now, the question is, upper limb fractures should be elevated by means of a dash. So we have already read this. Now see, this is where familiarity comes. Because see, we have, so this is 16th question. So before reading the 16th question, we have done 15 questions previously, right? So we have already, what we have done, we have actually read A, B, C, and D. Okay, so you have some familiarity, right? You have a very strong memory of the question. So you know, okay, this I have read this upper limb fracture. So what are upper limbs? Arms. Okay, so see, this is why synonym recognition. Synonym recognition is very important. Upper limbs basically means arms. Okay, upper limb fractures should be elevated by means of a what? Okay, the key word is elevated. Upper arms. The linking word over here is by means. That is using what? Means using what? So so you have to understand what means, right? So means does not mean the meaning. Using what should you elevate? Okay, that is what this word over here means. So you know the answer is most likely, okay, so it is going to be in text B because the elevate was mentioned over here. Now you see, elevate the limb, and for upper arm injuries, it is sling, right? So what you will be writing the answer? The answer will be sling. Okay, so upper arm injury should be elevated by means of a sling. Now you see here that they have written a sling, right? Now see over here, now see, here they have written a sling. So you have found the answer. You have read the question, you have found the answer, you're very happy, and you're coming over here and you are writing, you're writing a sling. Do you think you will get full marks? No. Why? Because already a is mentioned here. So if a is mentioned over here, then why is this a over here? If this a is not here, then you can write the entire thing. Okay. So see, an upper limb fracture should be elevated by means of a sling, not a grammatically accurate sentence, right? So this a over here is not required. So just put a cross mark. So sling is the only thing that is needed. right? So this is why grammar is a little bit important over here, right? So now let's just come to the 19th and the 20th question. So the 19th question over here is, in a plaster black slab, there is a layer of dash closest to the skin. Okay, so this is a tricky question over here. Okay, so here the keyword is plaster black slab. So where is the answer going to be? It is going to be in text D. Okay, now what is the linking word? The linking word is a layer. Okay, so for example, just imagine think about a sandwich. Think about sandwich. Okay, so first there will be a piece of bread. On top of that, a tomato. On top of that, a cucumber. On top of that, potato. Top of that, onion. Top of that, some kind of coconut or coriander chutney. And then on top of that, another piece of bread. So there is multiple layers. Okay, so over here, so like that you have to imagine. Okay, so in a plaster back slab. So when we are applying a plaster black slab, there is a layer. Okay, there is a layer of something. So a product. Okay, what product is used as a layer closest to the skin? Okay, so the skin, and this is the product that is the closest to the skin, used as a layer. Okay, so we know the answer is going to be in text D. So you should be able to come to text D. Now you should have the memory of the question to in your mind. What should be used as the layer closest to the skin? So here they have written measure a length. So that was the very first step over here. The very first step over here is measure a length of non-compression cotton stockinette from halfway up to the middle finger to just below the elbow. Width should be 2 to 3 centimeters more than the width of the distal arm. So here they're telling you need to measure. You need to measure this. This is the product you need to use, non-compression cotton stockinette. Okay, from halfway up to the middle finger. Okay, so the length they are talking about, and just below the elbow, and the width should be this much. And here they're telling more than the width of the distal arm. Wrap cotton padding over top for the full length of the stockinette. 2 layers and 50% overlap. So here we have two products over here. So here they have written cotton padding. Okay, so here they have written cotton padding, and here they have written stockinette, right? And this is what we have to use for 2 layers. So the question, so remember the question, closest to the skin, what product should we use as the first layer? Now see, here they have written wrap cotton padding over top for the full length of the stockinette. So that means you have to apply the cotton padding on top of the stockinette. Okay, so first you have to apply the stockinette, and on top of that, you have to apply the cotton padding. So we are using there are two things. Cotton padding is used as a layer, stockinette, okay, non-compression cotton stockinette is also used. But which product is the closest layer to the skin? The stockinette is the closest layer, right? Because that is what the question is asking you. Okay, so even though they have mentioned cotton's padding over here, you should be able to determine that the closest to the skin is basically stockinette or the non-compression cotton stockinette. So whatever if you want, you can write. So let's just go to the answer option. So let's see if we are correct. So the answer key over here, now see, if you want, you can write stockinette. If you want, you can write non-compression stockinette, or if you want, you can write cotton stockinette, or you can write non-compression. So all these answer options are accepted. Okay, so you can write among these four, any one. There is no need to write everything, just one among these four you can write. Right. So anyway, so let's take, so 70 years. Okay, so the 20th answer is 70 years. So let's understand why 70 years is the right answer. So patients aged. So age means what? Obviously, it is going to be a number. It is going to be a numerical digit, right? So patient age, so that is the linking word over here. And over should not be given the higher doses of pain relief. Okay, should not be given. So where did we read about pain relief? In text C, right? In text C only we read it. So this is where. So your intuition should be coming to text C. Right, very good. Now let's see over here whether patient's age is mentioned. So nothing is over here. So we are scanning, okay? So you're not reading the entire thing, okay? There is no need to read each and every word of you, just scanning. Patient's age. That's the only thing. So adult. So adult is an age, okay? Over here, no, adult does age, okay? But still, they are not talking about patient's age who should not be given. So here the question was asking who should not be given painkillers. You see, now you see, use the lower end of the dose range in patients greater than or equal to 70 years. Okay, so those people who are equal to 70 years or those people who are above the age of 70, we should use the lower end. Lower end means low dosage. Okay, we should not give them high dosage. So what is the answer? So can we write the answer as like this? So in the question we read something like this, right? Okay, so I'm just writing like this. Okay, greater than or equal to 70. Okay, that was it mentioned. Okay, so can we write like this or can we write just 70? Okay, so once again, here they have written patient's aged. Patient's aged means the age of the patient is 70. And here over. Over means what? Above. So already this is mentioned. Okay, the greater than and equal to is already mentioned in the question. So there is no need for you to write once again these two symbols. So just write 70. Okay, 70 is on enough. Okay, patient's age 70, or if you want, you can write 70 years. Both are absolute. Either 70 or 70 years you can write. Okay, and over should not be given the higher dose of saline relief. Right, now you see, this is how you should be able to do the listening reading part A. Right, so let's just take a small recap of what the discussion. Yeah, so Chinchu, you're right. Right, so let's just see. Okay, first and foremost, you have to be a strategist. Okay, without the right strategies, there is no point. Simply knowing the rules and regulations of OET and simply knowing some basic English is not going to be sufficient. Right, you must have the right skills with you and you must have the right techniques, the right methods, the right approach, and you need to have mastery over yourself. Only then you should go and appear for this OET examination. Until then, you have to be very patient and very gentle with yourself to develop yourself to that level. If you want to get a really good score, this is what you need to do. And it happens very easily. It does not take 3-4 years and all. Within just 3-4 weeks itself, if you want, if you are quite committed to the preparation process, with the Cambridge University materials, with our guidance, you definitely can reach that level. Right. So what did we discuss? Start with the questions first. The OET is not giving you marks for reading text A, B, C, and D. They're giving you marks for finding answers to the questions. So start with the questions first. And before coming to the question, just read the main headings. Okay, just read the headings. Read with a purpose. If you read with a purpose, there is quality in your reading. Instead of blind reading, you're reading with a high quality. So you're registering the information to your memory. And you must be able to trust your intuition, right? You're a medical professional. You have experience over here. Everything over here is medical content. So therefore, your instincts will help you out. So you just have to believe in yourself. Right, that belief you need to develop. So you have to be a very good friend over here. Right, and that faith in yourself will definitely push you to success. And again, time management. Okay, there is no need for you to read the entire thing. Okay, register the effective keywords. Okay, you should have a memory of the keywords. Okay, and with that memory, you should be able to scan and skim. Okay, so that you can finish everything in the 15-minute time limit. Synonym recognition. See, we read a lot of questions, right? Did you see the same words repeating in the text for all the questions? No. They use a lot of different synonyms. So that skill is very important, synonym recognition. And don't get stuck. Sometimes you will come across a difficult question, and maybe the very difficult question will be in the mastery following questions itself. Sometimes the most difficult question will be in the mastery following question. So let's imagine that maybe the first question. Maybe the first question itself is, imagine, it's very, very time consuming. No problem. Just temporarily skip it. Just don't get stuck over there. Just skip it and go to the next question. So do all the easy questions like this first. And once you have done all the easy questions, then you come to the questions that you skipped. So at least you're very happy, right? So just imagine that you have found answers to all the questions and now you have 30 seconds or 40 seconds left. So very comfortably, you can come to the first question and you can find, okay, what is the answer? And by the time now you're very familiar, you're very familiar with all the four texts, and that familiarity will definitely help you, right? So you should know when to move on. Okay, you should know when to move on from difficult questions and prioritize the easy questions, and always begin with match the following questions. Okay, because there are so many advantages. You're not putting into yourself into stress mode, you're boosting your confidence levels, you're establishing a familiarity. And by the time the other students are starting with the first question, you are starting with the eighth question. So massive difference is there. That is the importance of having the right strategies. Right, and that familiarity will help you to do the easy, difficult questions. So we already discussed that the time consuming questions, fill in the blank questions, are very difficult because it requires a lot more depth. Okay, so if you have that familiarity, it becomes a little bit more easier. And you have to be grammatically accurate, especially for fill in the blank questions. Fill in the blank questions means you have to give importance to the entire sentence and make sure that when you're writing the correct, so you have put a lot of effort and you have found the correct answer. Right. But simply don't write what you see. You have to ensure that this forms a meaningful grammatical sentence. So that grammatical accuracy you have to ensure. And you have to make sure that you are calm under pressure. Okay, that's very important. Okay, I'll just give you a very small example to understand that. So just imagine that it's a full moon night. Okay, so in the sky there is the moon's there, and you are looking in a pond. Okay, you're looking in a pond. So this is a pond over here. Now, if the pond is very still, okay, if the pond is very still, if the pond is very calm, if there is no disturbance, then how is the reflection going to be? The reflection of the moon is going to be very, very clear, right? You can very clearly see the reflection of the moon. But what is the situation if the pond is disturbed? Okay, if the pond is disturbed, if there are a lot of disturbance going on, so, people are, throwing stones in it, how is the reflection going to be? Do you think the reflection is going to be very clear? No, you cannot see anything. So this is exactly how your mind works. Okay, for listening and reading, for writing and speaking. Okay, you should have a very calm state of mind. Only then you will have thought clarity. And that thought clarity is extremely important for you to achieve success. So that ability to stay calm under pressure is very, very important. Okay, so stay calm, composed, and efficient during the examination. And this only happens if you practice with the Cambridge University material. So all these skills over here that you need, you will only be developing it if you're practicing with the Cambridge Boxer language assessment. Practicing with any random material you get from YouTube or from other institutions and all, they love to give you fake OET materials because it is very easy to teach and it is very easy to cheat students as well. But I am not such a person, right? So even if it is very stressful for me myself, I don't mind putting the effort by teaching with the Cambridge University materials. It's very difficult to teach, but this is the effort. So sometimes you may have to practice. You may have to practice the same material 2, 3, 4 times. No problem. Okay. It is much better than practicing the OET multiple times. So just write one small equation for you over here. Okay. It's very important that you understand this. A very funny thing, not funny thing. It's a fun way. In a very serious point, I will just say. So either you must be comfortable practicing the Cambridge materials multiple times, or you must be comfortable with attempting the OET multiple times. So you have basically two options. Okay, so again, not to hurt anyone's feelings, right? So this is a thing that students make a lot of very brilliant students. The reason why very, very brilliant students struggle to clear the OET when they're supposed to clear it in the first attempt itself is because they don't have access to the official OET material, so they have not been educated regarding the importance of what OET is and how to prepare the OET. All right, so here is a very simple equation. So if a student is really serious about clearing the OET, that student must be comfortable practicing the Cambridge University materials multiple times. Okay, the same material they have to be very happily and very comfortable. They must be using. They must be comfortable practicing multiple times. Or the student is like, no, I have practiced this material one time. I'm not going to do it. I need a fresh material, so I'm going to do a fake OET material. So that students, those type of students, they should be comfortable with attempting the OET multiple times. So you have two options: either to attempt the OET multiple times or to practice the Cambridge materials multiple times. It's either one of the two. So the smart students will know what decision to take. Right. So again, that's it. So that was the end of the today's session.